Bismillahirrahmanirrahim. Hello everybody. So a 24-year-old woman, Gravida 1 para 0, come to the office for her first prenatal visit after a positive home pregnancy test. Her last menstrual period was 9 weeks ago. Prior to conception, she had a regular 28-day cycles with heavier and longer periods after stopping oral contraceptive last year. The patient had some nausea and vomiting, but no cramps or vaginal bleeding. On review of the symptoms, she says the voiding is uncomfortable and she often has the feeling of incomplete bladder emptying. This had been happening for a while prior to pregnancy and she had gotten used to it, but it's getting worse. This patient has no medical condition. She takes a daily prenatal vitamin and no other medication. By manual examination shows a 15-week size immobile uterus with irregular contour. Which of the following is the most likely etiology of her date, size, date discrepancies? So adenomyosis, complete mole, endometriosis, leiomyomata uteri, incorrect dating, multiple gestation, polyhydramnios. So this patient is 24-year-old woman. She came to us with complaint of having heavier and longer periods prior to conception. She having voiding difficulty and feeling of incomplete bladder emptying, which is getting worse. On pelvic examination, she having size date discrepancies with mobile uterus and irregular contour of the uterus. So the diagnosis of this question is leiomyomata uteri, which is a benign uterus fibroids, which is also called fibroids. So why leiomyomata uteri? Because this patient present with a discrepancies between the uterine size and calculated gestational age based on last menstrual period. A history of heavier, longer menses with pelvic pressure suggests a condition predating the current pregnancy. This feature, in addition to this patient, enlarged uterus with irregular contour, are most consistent with leiomyomata uteri, which is a benign uterine fibroids. Fibroids are often asymptomatic, but large size and position in relation to other pelvic organ can lead to pelvic pressure, urinary frequency, or incomplete voiding and constipation. So here the correct option is choice D. Now come to the incorrect one, adenomyosis. So although adenomyosis can cause heavy menstrual bleeding, however, the uterine enlargement in adenomyosis is diffuse and relatively small. Choice B, incomplete mole. This patient has an irregularly enlarged uterus, pre-existing pelvic pressure symptom and no vaginal bleeding, making a complete mole a less likely cause of size date discrepancies. Choice C, endometriosis. So endometriosis does not cause uterine enlargement, and adhesion from fibrosis due to endometriosis make the uterus and other pelvic organ immobile. This patient has a mobile uterus. I will explain choice E and F together, which is incorrect. So incorrect dating and multiple gestation are common cause of size date discrepancies, but are not the likely etiology in this patient due to an irregular uterine contour present on physical examination. Choice G, polyhydramnios. So polyhydramnios is a cause of size date discrepancies in the second and third trimester. Patient may present with shortness of breath and a uniformly enlarged gravid uterus. Thank you.